Hello, everyone. This is Sangeeta. We all know that the last year had been filled with ups and downs as humanity has been suffering from the dreadful COVID 19 virus. Fortunately, our hardworking doctors and scientists have been able to make a vaccine that gave us hope for a brighter future. Bhaga is trying to make a series of informational posts in order to help spread COVID vaccine awareness to our members. Would like to give a special thanks to Dr. Dimple Mojumdar for sharing her experience on the COVID vaccine. Today, I would like to introduce Dr. Abhijit Ghatak. He is a practicing interventional cardiologist in Lawrenceville and Kensville location. He is trained at University of Connecticut for internal medicine and at the University of Miami, Florida for cardiology and interventional cardiology. He has taken care of numerous COVID 19 patients at the hospital during this pandemic. We would like to get some perspective on the current COVID 19 vaccination. Hello, Dr. Ghatak.
Hi, how are you?
Good. So
Excellent.
today, yeah, we have some questions from our members. So let us, if you can go to the.
Yeah, yes, please feel free to go over the questions. Yeah.
So, so doctor, what are the different varieties of COVID vaccine available in USA, and are there any difference between them?
Sure. So yes, I understand there is a lot of questions and confusion around the vaccine that's are available. So first thing, these vaccines, as you all know, that this disease is fairly recent. So these vaccines have gone through expedited review by the FDA. So none of these vaccines are actually licensed, but they are under the EUA, which is essentially the emergency use authorization by the FDA. So I need to clarify that these all vaccines which are currently in use, they have gone through the phase 1, 2, and 3, which is usually how a vaccine is developed. The only difference is we have been quicker in going through each of these phases because, of course, this pandemic is currently ravaging through the whole of the humanity, all the continents. So currently there are two vaccines that are currently in use in United States. These are both mRNA vaccine, and they target the spike protein of the virus. So the spike protein is the protein with which the virus attaches itself to the host cell or the human cell. So these vaccines provide immunity to prevent attachment of the virus to the host cells and neutralizes the virus. So this is how these vaccines work. There is a vaccine by the Pfizer company, and the other one is called the Moderna vaccine. Both of them are similar in their efficacy. In the studies, they have shown that both of them have around 95% efficacy. They are given at a certain time duration, and the availability is what kind of will dictate which vaccine you will end up getting. They are absolutely similar in their efficacy and their safety. So to a short answer to your question is Pfizer and the Moderna are the two vaccines, and both of them require 2 doses.
So my next question is, are the post-vaccination side effects different for these two vaccines?
The answer is no. Both of these vaccines have some mild side effects, either local side effects, which means at the site of vaccination. Both of them are administered intramuscularly, mostly in your deltoid, it's the upper arm where it is administered. They have local side effects, pain, mild swelling, redness, or systemic, which means fever, headache, and these and like more of a fatigue and malaise side effect, but they are not different between these two vaccines. As far as severe reactions are concerned, they are also comparable. The severe reaction, which we mean like anaphylaxis, what it means is that if for example, if someone is stung by a bee and they have swelling all over their body, they have issues with breathing, they have tongue swelling or throat swelling, that those are the severe side effects. And both of these vaccines, for example, Pfizer has about 5 cases of anaphylaxis per 1 million vaccinations, and the Moderna has about 2.5 cases of this severe anaphylaxis. So in nutshell, both of them are, they have the same safety efficacy, and the side effects are very comparable.
Okay, so what should be the gap between shot one and shot two? And is it different for different vaccines?
So the Pfizer has a 21-day gap. So once you get the vaccine on day one, you need to get the second dose within 21st day, usually 3 weeks. The Moderna is the same, around 28 days, so about a month. But right now, the recommendation is, if for some reason, and there are certain scenarios where for some reason people miss the second dose, they
Mhm.
can go up to 6 weeks to get the second dose. And in situations where they miss that time period, as per CDC recommendation, you should get it as soon as possible. There are certain situations that will arise because once you get the first dose, you can still get the COVID-19 infection. If you get that infection while you're waiting for the second dose, or before you get the first dose, it is shown that reinfection rate is fairly low within the first 90 days, 3 months. So the second dose can be deferred up to 90 days in such situations where the person gets the infection after the first shot, or before the first shot. So that's essentially a little twist to the vaccination protocol. But overall, it's uh, roughly 21 days and 28 days, so 3 weeks or 4 weeks, depending on the vaccine.
Does the post-vaccination side effect varies from shot one to shot two?
Yes, the shot one is more milder. Shot two, usually people get a little bit more side effects in form of fever, fatigue, headaches. Usually, in individuals, in older individuals, the side effects are little less attenuate, or they are a little less as compared to younger individuals. So the side effects are a little more on the second shot. But again, you have to be careful, because if you still have the side effects, especially fever, malaise, which are also the side effects from the COVID-19 infection, if they are still there after 3 or 4 days of the vaccine administration, the second dose, you should get checked for COVID-19, because there is a chance that you may have acquired it between, while you are getting the vaccination as well. So that chance is there. So always be careful.
Okay, thank you, doctor. Then my next question will be, what are the guidances we still need to follow even after taking both the doses?
Okay. So, COVID vaccinate, you may still get the COVID infection after the vaccination. So, and also currently the duration of protection after the vaccination is unknown. We do not know how long these antibodies will last us. So the preventative measures, including the CDC guidelines of social distancing, face mask, avoiding crowded place, and limiting exposure, should be followed as per guidelines. So those are still in place, and those things should also be followed.
So, can we still have COVID, uh, or can we still be a carrier after taking the vaccine?
The answer is yes. You can still have the COVID infection after getting the vaccine, and you can still be the carrier. So the history of vaccine receipt does not change any other approach to the preventative measures that we have in place. But the only thing the thing that vaccine will guarantee that even if you have COVID-19, it will not be as severe as if you were not vaccinated. In a way, in a way, it protects people from severe COVID associated illness and death. So that is the only, thing that will change after you have the COVID-19 vaccine.
So, my next question will be, do we have to take COVID vaccine every year like the flu shot?
So, as I mentioned in the prior question, that we really do not know how long this immunity is going to last after we get the COVID-19 shot. So, as of now, it's not clear whether we have to take it every year. As of now, it is likely that we will have to take this for prolonged period of time, as much as once the herd immunity is acquired, we will have to reassess and see how this virus is behaving. Of course, we are aware that there are mutant strains. There is a South African variant of this virus which is also being shown. So it only time will tell as to whether this will become an annual event like the influenza vaccine or not.
So, is there any circumstances under which we should not take the vaccine?
Okay. So, if, as I mentioned, the anaphylaxis, which is severe allergic reaction to the first dose of the vaccine, in form of swelling of the throat, swelling of the tongue, full like hives where you have swelling all across your body, respiratory distress, wheezing essentially is a sound that comes out of your lungs if there is a problem in the air exchange or the breathing. If someone has that after the first shot, it is contraindicated to take the second shot. The second thing is there are certain components in the vaccine like polyethylene glycol. Actually, CDC has a full set of ingredients on their website, so people should go through those to make sure that they are not individually allergic to these components. As far as local reaction is concerned, like local swelling in the site of the injection, or if someone has fever, headache, fatigue, minor side effects, usually last for 1 or 2 days, those people should go ahead and take the second shot. Even in right now during pregnancy and lactation, it is recommended that people should consider getting the vaccine. Of course, for elderly patients, for patients who are immunocompromised, means patients who are on medications to lower their immunity. For example, people who are transplant recipient like kidney transplant, liver transplant, they are usually on medications like steroids and other immune suppressing medications. Even in these patients, it is recommended that they should consider getting the vaccine to prevent the serious illness associated with the COVID-19.
So, one question comes to my mind, that is everybody eligible for the vaccine and even our visiting parents?
Yes, right now, as we know that the vaccine has been rolled out in phases, so everybody is eligible. The vaccine is available without any charge to the recipient. Anyone above the age of 65, their caregivers, anyone, first responders, healthcare professionals. We are all eligible for the vaccine without any charge to them.
So, Doctor, my last question will be what will be your advice to the BAGA community regarding the COVID vaccine?
So I have taken my vaccine. It did hurt a little bit, but again, that's a day or so, and after that, I did not have any side effects. My sincere recommendations would be that please try to get the vaccine if you are eligible in the phase 1A plus to get the vaccine so that it protects you from getting the severe COVID-associated illness and preventing death. There is, you know, I am in the hospital and I can see that the cases are still there. At one point, every other patient that I was called on had COVID, and there are a lot of deaths still happening in the hospital, in the ICUs associated with COVID-19. We are fortunate that with the, as you mentioned, with the hard work of the scientists and the physicians, we have come up with at least some solution to this pandemic. So my recommendation would be please go ahead and get the vaccine when you can find and if you are eligible for it. Various websites. You can talk to your primary care doctor about how they are planning this. Department of Health online has some slots which they open every week, and of course, for reasons they get filled up as quickly as they open. So you have to be very much online to try and book one of these slots. You can talk to people who have insurance. Please talk to your insurance provider, and they can help you out with finding a location which will provide you with the vaccine. Some of the pharmacies, I looked up the website, and some of the Kroger pharmacies have been provided with some of these COVID-19 supplies, which will help in getting these vaccines. So there will be some delays because, of course, something unprecedented as like this, we were not prepared for it. So at every level there will be some delays, but as as we know that just the vaccine does not prevent, it's the process of vaccination that prevents a disease. So the more people who I mean, when we get more people vaccinated, that's when we will beat this pandemic. So in short, please get your vaccine when you can, and let's all try to fight it together.
Thank you so much, Dr. Ghatak, for spending your valuable time with us and discussing about the COVID vaccine. Uh, you can I so you can contact Dr. Ghatak through email directly at kurdsmtghatak@gmail.com for further inquiries. I mentioned Kurds, KURDSMDGHATAK at gmail.com.
Thank you very much for this opportunity, Sangeeta, and thank you for having me on this.
We encourage all of you to take the vaccine when available to protect yourself and help to put an end to COVID. Thank you. Take care and stay safe.
Thank you so much.